Have you ever felt a strange heaviness in your chest and wondered if it meant something serious? A patient of mine once shared that her chest felt tight every evening, like someone was gently pressing a hand against her ribs, yet every test said her heart was fine. I want you to imagine this for a moment. You're sitting quietly at the end of the day, the house is calm, and out of nowhere, you feel that familiar pressure rising again. Not sharp pain, not panic, just a weight you can't quite explain. And suddenly, you're left wondering, is this something dangerous, or is my body trying to tell me something else? Chest pressure in seniors is often misunderstood. Many older adults fear the worst and assume it must be a heart attack. But the truth is, chest pressure has many possible causes, and most of them are not emergencies. A tight feeling across the chest, a band-like squeeze, or a heaviness that comes and goes can be related to aging, inflammation, circulation changes, lung stiffness, or even posture. The heart is not always the only suspect. What most people never hear is that doctors often focus on major cardiac events, but overlook the more subtle causes that affect seniors every day. Muscle tension from years of protective posture, digestive pressure pushing upward, anxiety that settles into the chest at night, or shallow breathing that doesn't move enough oxygen through the lungs can all create sensations easily mistaken for heart trouble. As we age, the rib cage stiffens, the respiratory muscles weaken, and the nerves around the heart become more sensitive. Even emotional stress or loneliness in the quiet hours of the evening can make chest pressure feel much more alarming. In this video, you'll learn the surprising non-cardiac causes behind chest pressure, the signs that truly require medical attention, and how factors like inflammation, posture, breathing habits, digestion, and hydration influence what you feel in your chest. You'll also discover practical techniques to ease these sensations, helpful supplements, and real stories from seniors who finally found clarity after years of confusion. I want you to feel reassured as we walk through this together. You're not imagining your symptoms, and you're not alone. Most chest pressure in seniors is explainable, treatable, and often preventable. Your body is speaking to you, and I'm here to help you understand what it's saying. If this resonates with you, I invite you to subscribe to Senior Health Daily so we can continue this journey toward comfort, confidence, and better heart health together. The science behind chest pressure. In seniors, chest pressure is one of the most confusing sensations seniors experience, and understanding the science behind it is the first step toward clarity. As we age, the body changes in ways that most people never think about. The lungs, for example, lose a bit of their natural elasticity. The diaphragm, which is the main breathing muscle, becomes weaker. This means every breath you take doesn't expand as deeply as it once did, and shallow breathing can easily create that heavy or tight feeling in the chest. Many seniors think something is wrong with their heart, when in reality, their lungs and muscles are simply aging. The arteries also change with time. They stiffen, just like other parts of the body. When arteries become less flexible, blood doesn't flow as smoothly. The heart has to push a little harder, and this increased resistance can feel like pressure, even during simple activities like walking, bending, or getting ready for bed. It's not always pain. Sometimes it's a sense of fullness or a band tightening across the chest. Another part of the hidden science involves the nerves around the heart. As people age, nerve sensitivity increases. A sensation that you might have ignored at 30 can feel overwhelming at 70. I remember a patient who told me she felt waves of pressure throughout the day. After evaluation, we learned her heart was perfectly healthy, but her nerves were amplifying normal signals her body had always produced. These subtle changes often lead seniors to misinterpret their symptoms. I've worked with many older adults who lived with unnecessary fear for years, simply because no one explained how age affects the chest, lungs, nerves, and circulation. Once they understood the science, they felt relief even before making any lifestyle changes. Understanding these inner shifts gives you power. It helps you distinguish true danger from benign sensations. Now that you have this foundation, let's move into the next section, where we'll explore the situations when chest pressure does come from the heart and what signs truly matter. Heart-related causes. Now that we've explored the science behind how aging changes the chest and lungs, I want to gently guide you into a topic that many seniors fear but absolutely need to understand clearly: the situations when chest pressure truly does come from the heart. This part isn't meant to frighten you. It's meant to empower you, because fear thrives in confusion, but confidence grows with clarity. Heart-related chest pressure often has a different character than muscular or digestive discomfort. One of the most common cardiac causes is angina, which happens when the heart isn't getting enough oxygen-rich blood. Seniors often describe it not as a sharp pain, but as a heaviness or tight squeeze, especially during activity or emotional stress. What many people don't realize is that angina can feel subtle. It doesn't always show up as the dramatic chest clutch you see in movies. Sometimes it's just a pressure that slowly builds when walking uphill or after eating a heavy meal. Another key heart-related cause is atrial fibrillation, a rhythm issue where the heart beats irregularly. Many seniors dismiss this as fluttering, nervousness, or just getting older. But irregular rhythms can create pressure, fatigue, or a strange awareness of the heartbeat. High blood pressure spikes are another cause. When the pressure inside the arteries suddenly rises, the chest can feel tight or compressed, especially at night when the body is trying to rest. Poor nighttime circulation can also play a role. When lying flat, blood redistributes, and a heart already working harder due to age may struggle to keep everything moving comfortably. In rare cases, an enlarged heart or valve problems can create ongoing pressure that shouldn't be ignored. What breaks my heart is how often seniors minimize these symptoms. Many tell themselves, "It's nothing," or "I don't want to bother anyone." But early detection makes all the difference. I once cared for a gentleman who ignored recurring chest tightness for months, until one evening the pressure became unbearable. Fortunately, he arrived at the hospital in time, and with proper care, he recovered beautifully. Another patient recognized her symptoms early, came in right away, and avoided a major cardiac event altogether. Listening to your body doesn't make you dramatic. It makes you wise. And wisdom is what keeps you safe. Hidden triggers seniors encounter daily. Now that we've uncovered the heart-related and non-cardiac causes, I want to bring your attention to something even more surprising. Some of the most common triggers of chest pressure in seniors are not medical conditions at all. They're everyday habits and small lifestyle patterns that build quietly over time. These unnoticed triggers can cause sensations that feel frightening, even though the reason behind them is far simpler than most people realize. Eating late, for example, is something many older adults do without thinking. Maybe you weren't hungry earlier. Maybe your day ran long. But when you eat too close to bedtime, digestion becomes slower, heavier, and more active while your body is trying to wind down. That extra pressure in the stomach pushes upward on the diaphragm, leaving the chest feeling tight or full. Many seniors wake up with chest discomfort simply because their body is working overtime to process food. Sitting for long hours is another hidden culprit. Whether you're reading, watching TV, or simply resting, staying in one position compresses the lungs, slows circulation, and tightens the chest muscles. After 60, the body needs regular movement, even small movements, to keep oxygen and blood flowing freely. Without it, the chest can feel heavy or restricted long before the heart is involved. Sleeping flat on your back can create pressure too, especially if fluid collects around the lungs, or if digestion is still active. Some seniors tell me they wake up feeling like their chest is pushing inward, only to find relief by adjusting their pillows or sleeping slightly elevated. Dehydration is another subtle but powerful trigger. Without enough fluid, the blood becomes thicker, the heart works harder, and the breathing muscles become less efficient. Many seniors limit water in the evening to avoid nighttime trips to the bathroom, not realizing how deeply this affects their chest comfort. And emotional triggers matter as well. Anxiety before bed, worry about the future, or even an unresolved conversation can cause the chest to tighten without warning. The body often reacts physically to emotions long before the mind makes sense of them. Many seniors think something dangerous is happening, when in reality, the body is simply responding to an everyday trigger. Once you identify these patterns, you can shift them, soften them, and regain control over how your chest feels. Supplements that can help chest discomfort. As we continue this journey toward understanding chest pressure in seniors, I want to shift our attention to something both gentle and powerful. The supplements that can support your body when these sensations arise. Supplements are not cures, and they are not meant to replace medical care, but when chosen thoughtfully and used consistently, they can ease inflammation, improve circulation, calm muscle tension, and restore balance in ways many seniors find surprisingly comforting. One of the most helpful supplements for chest discomfort is magnesium. Magnesium plays a crucial role in muscle relaxation, including the muscles of the chest and diaphragm. Many older adults don't realize they are deficient, and that deficiency can lead to tightness, spasms, and shallow breathing. When magnesium levels are restored, breathing feels easier, the chest relaxes, and nighttime pressure often decreases. I've seen countless patients experience noticeable relief within just a few weeks of gentle supplementation. Omega-3 fatty acids are another powerful ally. They help reduce inflammation in the blood vessels, improve circulation, and support heart rhythm. When inflammation goes down, chest sensations often ease as well. Seniors who struggled with pressure linked to poor circulation or mild swelling often find that omega-3s give their body the boost it needs to feel more open and comfortable. CoQ10 is especially important for seniors on statins or those who feel fatigued easily. It helps the heart produce energy more efficiently. When the heart feels supported, it doesn't have to strain as much, and that can reduce the feeling of internal tightness many seniors describe as pressure. Vitamin D, paired with K2, supports the flexibility of the arteries. When arteries are softer and healthier, blood flows more freely, and the chest feels less tense. This is particularly important for seniors who get little sunlight or have chronic inflammation. Probiotics also deserve a mention because so much chest pressure actually comes from the digestive system. When the gut is balanced and functioning smoothly, there's less gas, less upward pressure, and less strain on the diaphragm. Electrolytes help with hydration and muscle function, especially in hotter climates or during times of increased activity. Even mild dehydration can tighten the chest and make breathing feel harder. These supplements, used with intention and guidance, offer real relief. They don't change who you are. They simply give your body the support it has quietly needed for years. Practical relief techniques for daily life. Now that we've explored supplements that can support the body, I want to share something just as important: the simple, practical techniques you can use every single day to reduce chest pressure. These are gentle habits that require no special equipment, no complicated routines, and no drastic changes. They're small shifts that remind your body how to breathe, move, and relax more naturally. One of the most helpful tools is diaphragm breathing. Many seniors breathe from the upper chest without realizing it, taking short, shallow breaths that tighten the lungs and create pressure. Diaphragm breathing invites the breath deeper, allowing the lower lungs to expand and the chest to soften. A few slow, intentional breaths can ease discomfort within minutes. I've seen this technique calm people who thought they were on the verge of a medical crisis. Chest opening stretches are another powerful practice. Simple movements like gently rolling the shoulders back, stretching the chest forward, or lifting the arms overhead help counteract the protective posture that so many older adults fall into. When the upper back loosens and the ribcage opens, the chest often feels instantly lighter. Posture resets throughout the day can make a world of difference. Sitting upright, keeping your neck relaxed, and allowing the ribcage to expand freely all help reduce unnecessary tension. Many seniors don't notice how hunched they become while reading, watching TV, or using a phone until their chest tightens in response. Warm compress therapy can also bring comfort. Placing a warm cloth or heating pad on the chest or upper back relaxes tight muscles and increases blood flow. It's a simple act of kindness to your body, especially after long periods of inactivity. Small evening walks help improve circulation and stabilize breathing patterns. Even 5 to 10 minutes can shift how the chest feels. Hydration habits play a role too, since dehydration thickens the blood and forces the heart to work harder. Adjusting pillow height or sleeping slightly elevated reduces nighttime chest pressure, especially for those sensitive to reflux or fluid buildup. And choosing anti-inflammatory foods supports long-term comfort. These practical techniques aren't meant to fix everything at once. They're gentle reminders to your body that it isn't alone, and that with a little daily care, comfort is entirely within reach. When chest pressure is a warning sign. As comforting as it is to know that many forms of chest pressure are harmless or easily explained, we also need to talk honestly about the moments when chest pressure does deserve immediate attention. This conversation isn't meant to scare you. It's meant to give you clarity, because knowing the difference between a benign sensation and a true warning can save your life. Chest pressure becomes concerning when it feels persistent, lasting longer than a few minutes, especially if it appears suddenly or intensifies with mild activity. If you notice pressure while doing something simple, like walking to the mailbox or carrying groceries, the heart may be signaling that it's struggling to keep up with the demand. Pay attention to any pressure that makes you pause, slow down, or catch your breath. Another warning sign is chest pressure, accompanied by sweating, nausea, dizziness, or a cold, clammy feeling. These symptoms suggest that the heart is under stress and needs help quickly. Seniors sometimes overlook these signs because they assume they're just tired or having a bad day. But your body gives these signals for a reason. Shortness of breath that comes on suddenly or gets worse while lying flat is also important. The heart and lungs work closely together, and when they struggle to exchange oxygen efficiently, the body reacts quickly. Pressure that spreads to the jaw, shoulder, back, or arm should never be ignored. Even if the pain isn't severe, the pattern itself matters. I've met many older adults who dismissed their symptoms for hours because they didn't want to make a fuss. But early action changes everything. Getting checked doesn't make you dramatic. It makes you wise and protective of your own well-being. I've seen lives saved simply because someone chose to listen to their body instead of waiting for the sensation to pass. Let this part empower you, not frighten you. Most chest pressure isn't dangerous, but when your body speaks loudly, it's asking for your attention. Listening is one of the greatest acts of self-care you can offer yourself. Personal stories that bring hope. As we bring this deeper understanding of chest pressure together, I want to share a few stories that have stayed with me throughout the years. These stories remind me why education, compassion, and patience matter so much, especially for seniors who often feel unheard or misunderstood. One woman I cared for, in her early 70s, came to me trembling with fear after months of nightly chest pressure. She was convinced something was terribly wrong with her heart, but after talking with her, examining her posture, and understanding her stress patterns, we discovered her symptoms were almost entirely related to anxiety and breath holding. She had been carrying emotional weight she never spoke about. Once she learned how to breathe deeply again, how to stretch her chest, and how to soothe her mind before bed, the pressure that haunted her for months slowly faded. She still sends me holiday cards to this day, grateful not just for the guidance, but for being listened to. Another patient experienced a heavy pressure after meals that felt frighteningly close to a cardiac event. After testing ruled out heart problems, we learned her diaphragm was being pushed upward by slow digestion and gas buildup. A few changes to her eating routine, along with digestive support supplements, transformed her evenings. She told me she had finally gotten her life back, simply because she understood her body better. I also remember a senior gentleman who noticed pressure every time he woke up. At first, he ignored it, assuming it was part of aging, but eventually he mentioned it during a visit. Testing revealed an early-stage cardiac issue that we were able to address before it became serious. His courage to speak up made all the difference. These stories carry a simple truth. Chest pressure is not something to fear, but something to understand. Sometimes it's emotional, sometimes it's physical, sometimes it's digestive, and sometimes it does require medical care. The power lies in listening, learning, and taking gentle action. As we reach the end of our conversation today, I want to leave you with something gentle yet powerful. Every sensation you feel in your chest, whether it is pressure, tightness, or heaviness, is not a punishment. It is a signal. Your body is speaking to you in the only language it knows. Seniors often tell me they feel embarrassed to bring up these symptoms or worry that they're overreacting. But you should never feel ashamed for listening to your body. You are not alone, and you deserve clarity, comfort, and peace of mind. Take a moment to appreciate the incredible journey your body has been on. Your chest, your lungs, your heart, and the muscles around them have worked tirelessly for you every single day of your life. They have carried you through joy, loss, excitement, and quiet moments. Caring for them now is not a burden. It is an act of honor, a way of thanking your body for every step it has taken with you. And here is the beautiful truth. The small choices you make each day truly matter. A few minutes of deep breathing, a little posture correction, a warm cup of water, the right supplement, or a short evening walk can shift how your chest feels. These simple habits can calm inflammation, restore easier breathing, and bring real comfort into your daily life. Healing doesn't require perfection. It grows from small, steady steps. Most importantly, even after 60, 70, or 80, your heart and lungs remain remarkably adaptable. Your body is always trying to heal, to adjust, to support you. With awareness and gentle care, comfort is possible. Confidence is possible. A calmer, easier life is possible. Your body still listens, responds, and heals. Your comfort tomorrow begins with the choices you make tonight. If today's message has helped you feel more understood and supported, I invite you to stay connected with Senior Health Daily. Subscribe for weekly guidance, practical tools, and heartfelt conversations. Together, we'll continue building a healthier, more peaceful future for your heart and lungs.